Hello, everyone who's joined the call today. Thank you so much for taking time out of your busy schedule to join Sarah Leek and I for setting a foundation for your QAPI program. This is Alana Jorman, and just a few housekeeping items. You are all on mute, and if you would like to ask any questions, make any comments, you can go ahead and use the chat function or the Q&A function, and these sessions are recorded. So with that, I'll let you take it away, Sarah.
Well, thank you, Alana. And again, we are doing our first session focusing on setting a foundation for your quality assurance and performance improvement program. So this is the first in a series of 6 sessions we'll be having. And our first 3 will be introducing the structure of the QAPI program. And the last 3 sessions will be focusing on how to use and interpret your data, and then its impact on outcomes and improvements in healthcare. The intent is for you to focus on your organization and your specific data during these sessions and identify how ideas and information can be applied. And we do encourage you, as Alana said, for your input, questions, and discussion. So today we will review the CMS's definition and elements of the Quality Assurance Performance Improvement Program, which we'll also be calling QAPI because that's quite a mouthful. We'll explore the importance of QAPI in your organization and for your patients. The QAPI elements 1 and 2 will also be looked at in more detail. And then Alana will be offering some homework for you to explore your organization QAPI activity before we meet again in the next session. So effective quality assurance performance improvement, or again QAPI, is critical to our national goals to improve care for individuals and improve health for our populations. In addition, these improvements can reduce the per capita costs in the healthcare delivery system. A QAPI plan includes systematic, comprehensive, data-driven, proactive approach to performance, management, and improvement. I know that's a bunch of wordfuls, but that is what it includes. So the 5 elements are illustrated on this slide and are the framework for developing, implementing, and sustaining QAPI. These elements are closely related and work in tandem. We'll quickly review the 5 elements here, but we'll be exploring them in more depth during the first 3 sessions. So on the left-hand top is the program, is design and scope. Your program should be ongoing and comprehensive to include the full range of services offered by your organization and your departments. It should address the systems of care and management practices aiming for safety and high quality using clinical interventions and listening to your patient's voice. The next one, governance and leadership, is to develop a culture seeking and instilling the input from facility staff, from patients, their families, and or their representatives. Leadership or governance function ensures that adequate resources exist to conduct these QAPI efforts. Next is the feedback, data systems, and monitoring. So your facility puts in place systems to monitor care and services, drawing data from multiple sources such as your patients again, your staff, your families, and others that will affect outcomes. So there's kind of we're getting a bit of a recurrence here on how important family, staff, patients, and those affecting the patient's healthcare is. A performance improvement project, or the PIP, is a concentrated effort on a particular problem in a defined area within the organization. The facility conducts PIPs to examine and improve care or services in areas that the facility identifies as needing attention. And lastly, the facility uses a systematic approach to determine when in-depth analysis is needed to fully understand a problem, its causes, and its implications of change. Additionally, facilities will be expected to develop policies and procedures and demonstrate their proficiency to prevent future events and to sustain the improvements. We wanted to define QAPI a bit, the QAPI and the QA and PI components of QAPI. It is the merger of two complementary approaches to quality: quality assurance, QA, and performance improvement, PI. Both involve looking for and using information. However, there are differences in how they are accomplished. So the quality assurance is a process of meeting quality standards and assuring that care reaches the acceptable levels. Typically, healthcare settings set these thresholds to comply with regulations or CMS requirements. They could also create standards that go beyond these regulations. Quality assurance is reactive and reflective effort to examine why a facility failed to meet certain standards. These activities do improve quality, but efforts often end once the standards are met. For performance improvement, it's a proactive and continuous study of processes within the intent to prevent or decrease likelihood of problems. You identify areas of opportunity and test new approaches to fix underlying causes that are persistent, or they could be systematic problems. PI aims to improve processes involved in healthcare delivery and can make good quality even better. So some of you have probably already been involved in QAPI within your organizations as either a CMS requirement, or you may have chosen to implement these concepts or one or all of these 5 areas that we reviewed in this last slide. What we'd like you to do is please in the chat add why you think QAPI is important, and especially if you have seen some benefits using the QAPI structure within your own organization. So I'm looking in the chat. Does anybody have any reason why they feel QAPI is important, or if they're using it?
I'll keep an eye on the chat box, Sarah, if you wanted to move on.
Okay. I do see ability to identify issues and then fix these. That's perfect. Thank you, Carrie. Improve processes and get to the bottom of the issues. Yep, that's doing the root cause analysis. Amber, we are looking to expand our QAPI to be more efficient. It's really, it's great to hear that you are using QAPI, and I hope some of this will be helpful for you in developing, especially with the elements 1 and 2 that we're covering today. See Michael, enhancing quality of resident life. And I will be interchanging when we discuss this, and I know Alana will be too, that QAPI can be used in, and I know it started in nursing home, but it's also being used in hospitals and applying also into the ambulatory setting, because there's some wonderful elements, tools, concepts that can be applied within all of these healthcare settings. See, Leisha allows you to keep an eye on the pulse of the organization. We use it daily to monitor issues and also to identify the positives to encourage feedback. I think that's a really good point, that the more successes you have and the feedback that you give will just encourage more creativity and improvement. Better fall prevention program. All right. We can look at these later on, but thank you so much for your input. Again, thanks for sharing. And Alana and I did a bit of brainstorming for these slides and on why the QAPI is important, and we actually found it very hard to stop. And as you can see, this word cloud's quite big and has a lot of different topics in it. I just wanted to touch upon maybe a couple of them. The design of the program must identify and understand the patient and the family voice. And QAPI concept uses data and tools to identify the root cause analysis. And I think that was mentioned in the chat. and it ultimately will eliminate problems at the source. And again, another item would be once QAPI is launched and sustained, many people report that it is rewarding and even an enjoyable way of working. QAPI and data and measuring your performance with data. Data helps identify your quality problems, but also identifies other opportunities for improvement. It accompanies by setting priorities for your action. QAPI is designed to measure systems of care that are derived from clinic or practice guidelines, processes by which an organization monitors important aspects of programs, systems, and processes. A systematic structure or process that is implemented is important for monitoring aspects of your QAPI program. The process will help identify causes to the issues, avoid repeat adverse events by guiding the team through a known adopted steps. We don't want to be in a continuous reactive mode in healthcare, but rather proactively mitigate or eliminate gaps in care. Systematic problems that can cause harm to staff or to patients, we certainly want to mitigate those. For example, think of how you report patient or staff safety incidents. You want to report those near misses because this gives an opportunity to fix those problems before they can cause harm. All right, Alana, would you like to go through element 1?
Certainly. Thank you, Amber, for reminding me to let everybody know that when you do want to put any type of comments or questions into the chat box, just make sure you're selecting all panelists and attendees so we can all be part of that really good conversation that's going on in there. All right, next slide, Sarah. So as we discussed, the element 1 for the QAPI program, design and scope, as you can see here on this graph, making an inventory of your current service lines and scope of services can really help focus on what those key issues or areas of concern your QAPI program should prioritize. We talked a little bit about this during one of our coalition, building a strong coalition webinar series that we did about a month ago. Just talking about doing kind of a skill set inventory, knowing, maybe you have somebody on your team who's lean certified or somebody who is really, really good at QAPI that maybe isn't part of the QAPI process. So doing that inventory really helps your team. Also knowing your current activities and requirements, such as the CMS conditions of participation and any accreditation standards, whether it's Joint Commission or DNV, helps to employ relevant and effective evidence-based practices. So it helps to produce the best outcomes your team is actually capable of. So go ahead and next slide, Sarah. All right, so when we talk about mission, vision, and purpose for your organization, I think any of you have been on some of the webinars I've done. I probably sound like a little bit of a broken record when I talk about setting your mission, vision, and purpose. It's so vital. And I think a lot of people too, maybe who have talked to me before, have said QAPI does not live in a department. Anyone ever heard of that? I do say it all the time when I work with people, just because it really doesn't. QAPI should be within every department and not part of your organizational culture. There are many things that we can think of when we hear the word culture, right? But for the sake of this training, I want you to envision yourself walking down a hallway within your organization, and you come up on an elderly couple who seem to be lost. What do? Do you keep walking, or do you stop and say, is there something I can help you with? This gesture, it's maybe an inherent thing for some people to do, but for others, this gesture is the kind of kindness that you want your organization to expect you do. This is part of your organizational culture. Just the way your organization defines your mission, vision, and purpose. So whether you're a hospital, a critical access hospital, a nursing home, community coalition member, you need structure. And establishing your vision, which is your inspiration, it's your dream of where you want to drive to. Your mission, this is the purpose of your organization, and it guides your actions your goals, your path forward as a team, and helps to prioritize decisions on where to focus your resources, our precious resources. That includes our monetary resources and our staff. The purpose statement, specifically for your QAPI program and process, will support the latter. It provides more specifics to support the mission and vision. How do you know how effective and efficient your QAPI program is? Using a structured tool like the QAPI self-assessment tool developed by CMS will provide a framework of questions to answer, and to answer candidly and honestly about your program. So based on your setting, your QAPI plan, according to CMS, must be updated at least annually. So your QAPI plan must be updated annually. So just as you have a process to review and update if needed, your policy and procedures, you also need to be looking at that QAPI plan. When you designate responsibility, accountability, and an approach to sustainability, all those abilities of your team will come to the surface. And then using tools like Team Steps, for those of you who are unfamiliar with Team Steps, it's very easy. You can Google it. It's through AHRQ, Just Culture, which is part of a safety culture. And then understanding cultural diversity with your team helps to ensure that when we communicate and work together, the energy is on the job, not how not to do the job. Go ahead, next slide, Sarah. All right, so do you know when the last time your QAPI plan was updated? If you don't, you may want to take a look at that. How do you define what your organizational priorities are? Do you know what they are? What types of regulations or standards do you need to comply with? These are the types of questions you can start with when designing your QAPI program, or there's a very structured QAPI assessment template that CMS has. Also, I mentioned in the previous slide regarding policy and procedures, how does your internal policies currently reflect what your design and scope strategies are? An example that Lake Superior Quality Improvement Network, QUIN, used within their QAPI toolkit for a QAPI plan to include verbiage addressing policies and procedures is things like identify and use data to monitor our performance, establish goals and thresholds for our performance measurement, utilize resident, staff, and family input, as Sarah was alluding to earlier, how much we're going to be saying that over and over, how important that staff and the family input is. Identify and prioritize problems and opportunities for improvement. Opportunities for improvement. Now, say that over and over because there's always opportunities for improvement. Systematically analyze underlying causes of systematic problems and adverse events. So your safety program. Develop corrective action or performance improvement activities. Also, how will you ensure orientation for your board members or your governing body, your employees? Also to promote transparency with patients, residents, and your community. What messaging and data is available to show your progress and to deliver high quality care? Are evidence-based practices used? And are you able to translate the use of them within your data? Then let's not forget metrics, how important these are for monitoring, evaluation, and benchmarking. Next slide. All right, I'm sure most of you probably are very familiar with SMART goals, but let's just take a minute and go through them. Setting realistic and appropriate goals is an important step toward achieving aims and objectives. The most beneficial goals are person-centered and SMART. So they're specific, measurable, achievable, relevant, and time-oriented. There are often slight variations for this acronym that you may have seen. All contain these core elements though. So let's break down what the SMART goal is. Specific. Achieve. The goal should be simple and it should be clear. It shouldn't be really confusing for others to read and understand what you really want to do. It needs to be clearly defined. By getting specific, you'll clearly define exactly what needs to be done. This includes the who, what, and how. Who can help? What can they do? How are they going to do it? And then measurable. How will you know you've achieved it? What criteria will be used to ascertain whether the goal has been reached? What kind of data? for a goal to be reached and have to be measured along the way. It can be very motivating to seeing the progress is being made. And measuring goals can encourage people to keep working on their goal when they see there's actual progress with their hard work. How will you know you've reached your goal? So that's the big question. How will you actually know you've achieved what you wanted to achieve? So let's talk about achievable. How realistic is it to accomplish? Does the goal match up with what you're trying to accomplish? With that organization, what organizational goals, what resources? So to be realistic, a goal can be something which you're both willing and able to do. Realistic and able. It's important, honestly, to evaluate abilities and scope. And then when we look at relevant, how does this goal fit into the overall picture? And then timely, by when will you achieve the goal? How long will it take you to realistically to achieve this goal? It should be grounded within a time frame. Without an end date, there's no sense of urgency, no reason to take any action. So having that specific time frame, it can really drive motivation to accomplish those necessary steps to achieve that goal. And the goals should be relevant time frames. Again, I can't say that enough. Small incremental changes, they benefit from daily to weekly time frames. So really paying attention. All right, next slide, Sarah. All right, Sarah, I think you're gonna go through QAPI element number 2.
Yes, we're gonna go through governance and leadership. According to CMS, as you can see, this is the building blocks again, and we're gonna focus on the governance and leadership. And according to CMS, focusing on governance and leadership for your QAPI program develops a culture that involves and fosters commitment through the voice of staff, patients, family, and community. Leadership assures that there's adequate resources existing to conduct the QAPI program effectively and its activities. For example, designating one or more persons to be accountable for QAPI, developing leadership and facility-wide training, and ensuring staff time, equipment, and technical training is available as needed. So the governing body leadership is vital to fostering a culture where QAPI is a priority by ensuring policies and developed to sustain the QAPI despite their changes in their personnel and in their turnover. So their policies are very important. Their responsibilities include setting the expectations around safety, quality, rights of the staff, rights of the patients, the choice, and respect by balancing safety with patient and or resident-centered rights and choices. The governing body or the leadership ensures staff accountability while creating an atmosphere where staff are comfortable identifying and reporting quality problems as well as opportunities for improvement. This slide has a list of key factors important to successful governance and leadership within the organizations. I'm sure that you can identify with many of them that are in your organization, but I'm going to touch upon a couple of them. Remember, QAPI is everyone's responsibility. Understanding your role and responsibility in your organization is vital to your day-to-day activities. So why should it be any different when it comes to knowing your roles and your expectations in the QAPI process? When we have clear expectations and model the attitude and the culture you want alive and well within your organization, it shows you the commitment you have and a role in developing solutions. Referencing the goals and strategy clearly in meetings helps to keep structure and stay on task. Identifying and using the QAPI strategies in developing, for example, key performance indicators within departments, keep staff accountable and committed. This slide illustrates the mile markers or the action stops that may help you on your road to implementing QAPI. We'll just go briefly through these stops, but we can certainly give you more information on these if you would like, and you could please contact either Alana or myself, and our contact information will be later on in some slides. Or you could go ahead and put in the chat box that you would like more information on this. So the stops include starting with the yield sign of leadership, responsibility, and accountability. You create a culture to support QAPI efforts and set the tone and provide resources. At mile marker 1, develop a deliberate approach to teamwork, which is a core requirement for success. Have a clear purpose, define roles, commitment, and active engagement for each member. Mile marker 2 is take your QAPI pulse. Alana spoke about the self-assessment, and this can help with evaluating which components are in place within your organization and also identify areas for development. Again, if you are interested, please chat or send an email to either Alana or myself. We do have versions for nursing home, for hospital, and the ambulatory care setting. Mile 3, identify your organization's guiding principles and scope that will give your organization direction. And Alana went in quite a bit of detail on that one. The yield sign 2 is developing your QAPI plan and tailor it to your organization and specific goals, purpose, and principles. Remember, this is a living document and can evolve throughout time. Mile 4 is conduct a QAPI awareness campaign and communicate with the staff, with patients, with family, and with the community. Mile 5 is develop a strategy for collecting and using QAPI data. This data will require a systematic action to achieve meaningful reporting for your organization. Mile 6, identify your gaps and opportunities which could lead to steps in identifying quality improvement opportunities and charting performance improvement teams and projects. And that takes you to the yield sign of prioritize your quality improvement opportunities and PIPs. I'd like to leave you with a list of some very key questions to consider when building the governance and leadership into your QAPI programs. These are offered for you to consider in determining the progress of QAPI Element 2 within your organization. We won't be going through them individually, but hopefully act as some kind of assistance for you. All right, Alana, I'll put the next slide up.
Great. So there is a small typo on this slide. We are not having a session next week on the 21st, but we will be having that on the 28th. So I apologize for that confusion. So in our next 2 sessions, we're going to discuss data, and excuse me, but we for sure won't be ending the conversation on it. Part of that organizational self-assessment, what I did see a few people asking about that, all of this is online. CMS has a few template self-assessments that you can use, but we can definitely put some of these into an email after the session today. So of course, QAPI including measures of clinical care, input from caregiver and patients. So as today through the sessions, through the slides that we went through, we talked a lot about how the importance of governance and leadership and design and scope. And then we also talked about that patient family perspective, how important that is to include those voices so that you have a very systematic and pragmatic approach to improving your QAPI program. Next slide, Sarah. All right, so some exploratory questions for you to take back to your QAPI team. So as we leave today, I hope that this was beneficial for you, and I hope you can take these questions back and maybe get a little bit more acquainted and involved in your QAPI program. How do I incorporate the organizational goals into department improvements? Is QAPI really, is it integrated in throughout every department within your organization? Number 1, how will I as administration, direct care, or indirect staff be involved in QAPI and performance improvement projects? How can we do this? And then what data do we use within our performance improvement teams? That's a big thing to ask your teams. what data, what quality data that you have available to you so you know what you're doing is making an improvement. Next slide, Sarah. These are just some tools. If right now, if you guys wanted to look at any of them, I had mentioned earlier about Lean. Also, Model for Improvement, the Plan PDSA, Plan, Do, Study, Act cycles. Also, tools to enhance QI initiatives, and then those team steps, and then the evidence-based principles, for quality improvement. Next slide. All right, and that is our contact information. So if any of you are interested in more information, you can't find the templates online, please reach out to us. We're more than happy to send you and help you along the way. So with that, I appreciate everybody coming on. Sarah, do you want to say any last regards?
I put in chat that I really thank everyone for their valuable input and chatting when we asked for some input on their QAPI program that they have. And again, yes, please reach out to either Alana or myself, and we will take note in the chat and send you information that you have requested.
Wonderful. You guys all have a wonderful rest of your day and rest of your week. Thank you.
Thank you.